health insurance premiums. That's coming swiftly for Georgians as a result of the Trump budget bill that was passed earlier this year. We are within months of a potential 20 to 40% increase in health insurance premiums for a typical Georgia family that's buying its health insurance through the Affordable Care Act exchange. Now, why are we here? Because Washington Republicans refused to extend these Affordable Care Act benefits in the Trump budget. I offered an amendment on the floor of the Senate to extend these Affordable Care Act benefits. But they have been focused on repeal of the Affordable Care Act since its inception more than a decade ago. And unless Republicans in Washington reverse course, Georgians will face 20 to 40% increases in their health insurance premiums next year. The enrollment period for the ACA insurance exchange begins in November of this year. And the insurance companies are already making public, and we can provide you with this information, what they estimate the increase in premiums will be next year because of the expiration of these Affordable Care Act benefits. We're talking 20%, 30%, 40% increases in premiums, health insurance premiums per year. We're talking about thousands of dollars per year in increased health insurance premiums. And when folks can't make their household finances work already with rent or the mortgage and the car payment and gas and groceries, the last thing Georgia families need right now is to be paying thousands of dollars more per year for their health insurance. So you'll hear from these distinguished speakers in just a moment. But again, I want to be very clear about the message today for members of the press. I am calling on Republicans in Washington to reverse course and to work across the aisle to prevent these massive increases in health insurance premiums that are coming for Georgians soon as a result of what they did in the Trump budget passed earlier this year. Now pleased to yield to Deborah Scott of Georgia Stand Up. Thank you, Deborah.
Thank you. Good morning. Today we stand here with Senator Ossoff to encourage our congressional delegations all across the country to work across the aisle to prevent this bad thing from happening. It's driving up health care for everyone. Our communities will suffer, the hospitals will suffer, our rural communities will suffer, gig workers, construction workers will suffer. Anyone using the system will suffer. Georgians will suffer. Every congressional district will be affected. The enhanced premium tax credits lower the marketplace health insurance costs for all of us, and we need it. We know that Georgians will suffer, and we love Georgia. We want to make sure that all the congressional representatives understand that you are hurting your people if you don't make sure the enhanced credits gets reaffirmed. We want to make sure that our people continue to live comfortably here in Georgia, that they are already under attack, and that this cannot continue to happen. Georgia stands up. Georgia stands up. Georgia will stand up, and Georgia stands up with Senator Ossoff. Thank you.
Thank you. I think always very powerful, Deborah. And now pleased to welcome Lloyd Sermons of the Georgia Rural Healthcare Association. Lloyd?
Absolutely. Thank you so much. Thank you for you and your team inviting the Rural Health Association to be a part of this conversation. And what we all know is, it's a very important a thing. And as we was having our conversation there at the round table, one of the things that we were talking about was this is not just going to affect underserved people. This is going to affect a lot of people. It's going to affect, you're underserved, but it's going to affect your elderly people who are going to see their premiums go up, drastically. It's going to affect your small business owners and their workers because, their premiums are going to go up. So you're going to have businesses who will no longer be able to afford to provide insurance, and then employees are going to have to make decisions. And I think at the end of the day, that's the thing that really kind of resonates with me most is when people have to start deciding if they're going to, be able to pay for the health care, or if they're going to be able to pay for their food, or things like that. We feel that, that health care is important, that everyone needs good health care, good quality health care, and I think allowing these tax, to expire, I think that this is something that, the Rural Health Association stands behind, and we want to see these things extended. So thank you very much.
Thank you, Lloyd. Whitney.
Thank you. My name is Whitney Griggs, and I'm the Director of Health Policy for Georgians for a Healthy Future, and I want to speak with you all today about the Georgia-specific impacts of the expiration of the enhanced premium tax credits. Georgia is uniquely positioned to be harmed by the expiration of these tax credits because of the success of Georgia Access, our state-based exchange. In the first year of Georgia Access's operation, we had over 1.5 million Georgians enroll in coverage. Georgia Access is now the second largest state-based marketplace in the country behind California, which really says something if you think about the population differences between those two states. We also have a heavy reliance on the subsidies in our marketplace. Over 60% of Georgia Access enrollees rely on these subsidies to make their health insurance affordable. The enhanced premium tax credits have allowed Georgia Access to be so successful, and they have allowed hundreds of thousands of Georgians to get coverage for the first time and put health coverage as something that's affordable and not something that they hope that they can be able to get for their families. As the Senator mentioned, we're starting to see the proposed rate increases come in, and they're really staggering. On average, Georgia is going to see a 22% increase in our premiums. And for the individuals that are higher income that currently receive subsidies, they're going to experience the greatest increase in costs because they'll have to fully pay the cost of their health insurance. So for example, a couple in Macon, Georgia, making $84,000 a year will see their annual increase in premiums go up by $18,000. These folks will be locked out of the marketplace, and a lot of these folks are in the category of not being quite old enough to receive Medicare, so a really uniquely vulnerable population. But these changes are not inevitable. There are steps that Congress can take to extend the enhanced premium tax credits to keep our marketplace stable and to ensure that almost 340,000 Georgians don't suddenly become uninsured. Thank you.
Thank you so much, Whitney. Gerald, did you want to say anything?
Attorney Gerald Griggs, 13th President of the Georgia State Conference, and we stand proudly, the NAACP, sorry. And we stand proudly with Senator Ossoff in demanding that we extend the tax credits because it's important that Georgians have quality health care. And so on behalf of the 3.3 million minorities in this state, 2.2 million African Americans, we want to make sure that quality health care is affordable and accessible to all of those individuals. But to all of the minorities who will suffer under this, we want to make sure that their voice is heard. And so on behalf of the Georgia State Conference of the NAACP, we stand with our senator demanding that our congressional representatives do what's in the best interest of Georgia, and that's to extend these tax credits so people can have affordable, accessible health care. Thank you.
Thank you, Gerald. And I neglected to acknowledge Jeff Graham of Georgia Equality when I took the podium. Do you have anything to add, Jeff? Okay. So open this up for questions on this or any subject in just a moment. But again, I want to make sure, in case this is your first time engaging with the subject, that you're all very clear on the message today. And that is that I am calling on congressional Republicans to reverse course and to prevent these massive health insurance premium increases that will result from the Trump budget bill unless Congress acts by the end of the year. And again, enrollment begins on the ACA exchanges for the next year in November. Insurance companies are already posting what they estimate the premium increases will be. This is not my office's analysis. This is what insurance companies are telling us they're going to charge next year. And what, for example, the Kaiser Family Foundation has looked at all of those projected increases, an average of 20+% premium increase, thousands of dollars per year in health insurance premium increases for Georgia families. So Republicans in Congress, they declined to include my amendment in the Trump budget bill. There is still time to fix it when we return to Washington. Yes, Dr. Boyne.
Senator, with what you've seen so far, how optimistic are you that there will be a turnaround?
Look, I always try to work across the aisle to deliver for the state, so I'm having conversations with my Republican colleagues. I'd hoped that they would join me in solving this problem with the Trump budget bill when it was on the floor this summer. Time is short, but there is still time to get something done if there's the will. Yes, Tia?
Will the increases, because the subsidies are going away, will they impact just the people on the exchanges, or will they have an impact, for example, on people who have private insurance? Yes.
Well, people are, first of all, buying private plans through the exchange, right?
I should say insurance through their employers.
Yeah, I expect that there will be an impact on the overall insurance market. The estimates that we've seen from the insurance companies so far are their estimates of how much premiums will increase for those who are making their purchases through the ACA exchange. Is that clear? Yeah.
Senator, we're here at the tail end of this roundtable.
Yeah.
You're already well versed in this issue, but what did you learn from speaking with these experts that you didn't know before?
Well, I think, it's not to say that I did not know these things before, but I think that what you heard emphasized in some of these public remarks as well is really important for the press and the public to understand, which is that we're talking about a level of increase in health insurance premiums that will force many Georgia families to make tough cuts elsewhere in their household budgets. Food, right? This is, medicine. Thousands of dollars per year, childcare. So this is going to hurt, right? And not just folks who are making the least money, but middle class, working class Georgians all across the state. The other thing we heard, and you heard it from, representative of rural health care here, is this is going to be a huge problem in rural Georgia and for rural hospitals. Because when people are uninsured, right? So if someone finds out in a couple of months that their health insurance premiums are going up thousands of dollars per year, and they got to choose between that and putting food on the table, then they may choose not to renew their health plan. They still need health care. So then they show up at a rural hospital, and that care has to be provided on an uncompensated basis, and they're likely sicker at that point than they would have been if they'd been able to go to a doctor earlier.
You mentioned that you would like congressional Republicans to act. Can you say what mechanisms still exist where the extension of the subsidies could come out in legislation?
Well, they could put it on the floor the first week we're back. We could get this done very swiftly. There'd be strong bipartisan support for it. But time is of the essence, right? The reason that I tried to amend the Trump budget bill to fix this midsummer is because, again, we're talking November when folks are seeing these new health insurance premiums on the exchange for next year. So Leader Thune and Speaker Johnson and the President need to move swiftly.
Senator, when you pretty much observe all of what's going on, the needs they've said for cuts and budget reduction and such, who's benefiting from these particular rollbacks and cuts? I'm trying to figure out, it's not the insurance company, it's not the medical complex, it's not the individual, so where is the beneficiary, if you could even think about where that is?
The Trump administration's priority was tax cuts for the very, very wealthy. That was their priority in the Trump budget bill. And that was a higher priority for them than affordable health care for ordinary folks here in Georgia and across the country.
Senator, there's a growing growing roster of Republicans seeking to face you next year who are rallying around their support, not just for Donald Trump, but also his agenda, including this measure. Do you think this will still be top of mind of voters at this time next year when people are starting to actually make their decisions?
I think there is little more obvious and visible to folks than what they're paying for health insurance. I mean, this is a bill that's going to come due every month, and a lot of folks who are going to lose their insurance altogether. So, but putting the politics aside, we're talking about families across Georgia paying thousands and thousands of dollars more per year for health insurance, and a lot of folks being unable to afford health insurance altogether. So my hope is that we can take the politics out of it, and as soon as we return in September, fix this. We had the opportunity to fix it when the Trump budget was on the floor. They declined at that point. We can fix it when we get back.
Any other questions?
NAACP, Griggs, you're a nonpartisan organization. You're here with the senator today. How hard or not was it for you to show up?
It was very easy. When we're talking about providing health care to Georgians, it's not a political issue. This is a people issue. This is about providing care to Georgians. So I don't see this as a partisan issue. I see this as a people issue, and we will stand with the people, and any politician or elected official that stands with the people will stand with them.
Doug?
Can you answer another political question?
You can ask it.
Okay. A Republican by the name of Derek Dooley gave an interview this morning, apparently his first interview since he decided he was going to run for your seat. And one of the things that he talked about was how he was very immersed in his career during the 20 years that he never voted. How does that strike you?
Doug, as tempting as it is, I think I'm going to allow my Republican challengers to work this out amongst themselves for a while.
Anything else? Thank you all so much.
Thank you. All right. Thank you. Thanks. Thank you. Appreciate it.
Nice to meet you. Some way we're related. Somehow.
Well, it's my husband's last name.
Okay.
So, his family's from South Carolina. Your family from South Carolina? I mean, I see the resemblance. Right, I think your cousin.
Right now, we're about to face this, okay? They don't want you to see the real.
Tell my hello.
Your cousin. And I never find them stuff, and so I was like,